Good afternoon. Dave Cash, CEO, ZKR Orthopedics. Our mission, to create a minimally invasive treatment for patellofemoral cartilage degeneration and osteoarthritis. Talk about what we'll cover today in the presentation. Sore kneecaps, the #1 reason patients visit an orthopedist in the United States. Our founder, Dr. Jeff Halbrecht, invented a treatment for unloading the patellofemoral compartment to treat very sore kneecaps. At a conservative price point, these patients represent an annual revenue opportunity of about $2 billion. Existing codes provide lucrative reimbursement for the surgery center and physician. Data from the first in-human trial, 18 patients conducted by Dr. Konrad Slinarski in Warsaw, Poland, demonstrated improvements in pain and function. This data was sufficient to get an approval from the agency last month to enroll a 250-patient IDE trial. We have subsequently signed up KOLs and as investigators coast to coast. We'll talk about that. Lastly, we are raising a $20 million Series B to finance the IDE trial, conduct pre-market activities, and expand the technology platform to pediatrics and patellar instability. All right, chondromalacia patella. It's a Latin term, means sore kneecaps. No, I'm just kidding. Softening of the cartilage. It's a very prevalent disease. 70 million Americans have reported pat-fem pain, approximately 1 million treated annually. Our specific focus is on later stage cartilage degeneration, specifically outer bridge grades 3 and 4. Said differently, and an analogy we like to use, when the cracks and potholes show up in the pavement, we have an elegantly simple repair that extends the life of the native joint. Current treatment paradigm, nearly 1 million patients a year are treated conservatively. Starts with Advil, ice, bracing, progresses to injection therapies. Chondroplasty is cleaning up the edges of the potholes, microfracture, and then the late stage is obviously knee replacement. Our specific focus is between conservative care and late stage. The lift implant is an elegantly simple technology which unloads the compartment by elevating and realigning patellar tracking. I'll say that one more time. We unload the patellofemoral compartment by elevating and realigning patellar tracking. The mechanism of action is fairly simple. We unload the compartment by proximally by elevating the tendon. Further, the geometry of the implant realigns it from lateral to medial. The image here, the red represents the lesion. It's the same lesion in multiple planes represented here. In the second image, you can see the implant elevates the tracking of the patella up above the lesion. In the axial plane, which is represented by the third, again, same lesion location. 90 to 95% of the time, we tend to see lesions manifest in pat-fem disease on the lateral facet. And the geometry of the implant, in addition to elevating, slopes lateral to medial. It mimics the effect of a Fulkerson osteotomy. A couple of renderings here. I like the one on the far right that shows the geometry in flexion, again, elevation and lateral to medial realignment. Okay, evidence that it works. We conducted an 18-patient trial, Warsaw, Poland. All patients received the lift implant, and we measured follow-up out to 2 years. The graphs on the right, we improved pain 62% from baseline. We improved function 29% from baseline. Further, we saw the most amplified clinical effect in the sickest patients, those with full-blown osteoarthritis, grade 4 outer bridge. Importantly, two things. One, the number one safety metric we need to evaluate is influence on the tendon. We saw no evidence of necrosis, lengthening, shortening, alta, or baja. So from a tendon safety point of view, there were no issues reported. Second, none of the 18 patients progressed to total knee or partial knee replacement. Most of them are out to 3 years at this point. Market summary. We'll dive into the details in subsequent slides. We believe there are 600,000 existing surgeries in the United States annually on patients with patellofemoral disease. We forecast an ASP of approximately $4,000, representing gross margin profile of 95%, inclusive of a single-use instrument set. Existing codes provide reimbursement. Here are the details of our market quantification work. It's worth noting that of the earlier stage intervention, the lift technology may be used concomitantly with chondroplasty, graft procedures, and microfracture. Additionally, we believe that lift will become standard of care prior to unicompartmental knee replacement. As we think about ASP, we position slightly above the osteotomy sets that are available in the marketplace and well below primary knee implants. Interesting note, the Misha device, which recently gained approval, is out there between $8,000 and $10,000 ASP. It's a very similar device in that it unloads the neighboring compartment of the knee. Listed here are the existing reimbursement codes. 27422 for patellar realignment is a long-standing code. Attached there are the fees, shown there are the fees for the physician in the surgery center. It's worth noting the physician fee associated with that code is ostensibly equal to the much longer and more invasive knee arthroplasty. Our IDE trial was approved last month. It's a 250-patient trial, non-inferiority design, propensity matched, where we will compare the lift technology to tibial tubercle osteotomy. Interesting, very high probability of success based on the revision rate associated with TTOs. We've signed up the institutions displayed. It's a nice mix of brand name institution academic centers with various community hospitals. We are enrolling the treatment arm in the US and the TTO arm in the EU. From a timeline, it'll take us 6 to 7 quarters to enroll the trial and then 2-year follow-up. We have breakthrough designation accelerating the approval process. The differentiation from the IDE data coupled with a very strong IP portfolio positions us well for an exit prior to commercialization. If we have to go it alone, 95% gross margins and a $3,000 price point provides sufficient momentum to commercialize independently. I won't get into the details, but we have a strong and growing IP portfolio, strong management team, and the Series B raise, $20 million to finance the IDE, the approval, pre-market activities, and expand the product platform to patellar instability in pediatrics. Don't hesitate to contact me with any questions. Thanks.